Good afternoon. So if we go to Google and type in the etiology of acute upper respiratory infection, also known as the common cold, we get these results, and we'll find this study on the NIH website. And according to Google, the National Institute of Health is a government agency, and the first link is from Wikipedia. It's the primary agency of the United States government responsible for biomedical and public health research. So if we click on that NIH link, we come here and we see the summary. Experimental upper respiratory infections similar to common colds were transmitted through 2 of 4 passages in 9 out of 15 persons by intranasal inoculation. Basically, they had people lean back on a table or lying down on a table, and they spray injected this lab concoction up their nose. That's how they put it in there, and they were able to make 9 out of 15 people sick. These observations conform with those reported by previous workers and lend further support to the view that the incident of the common cold is a filterable virus. So that's the summary. So let's check out the full link. So this was done by Perrin H. Long, MD, and according to the New York Times, he headed the preventative medicine unit at Johns Hopkins and served at the Downstate Center, and then here's a link to his obituary. So if we go back to the actual article, so this was received for publication in 1930. Then he goes on to summarize the experiments done in the teens and the 20s of creating these lab concoction and how they did it and how they were able to make people sick by spraying this concoction into them. And then first he talks about how hard it is to make people sick with this, and all the failings and all the attempts that didn't work and some that did. And so in 1917, Erman Dold, he's a German, what does Wikipedia say? He's a German physician and bacteriologist, and he wrote something, and it's in German. The title's in German, the thing's in German, and my German sucks, so I couldn't read it, but someone who speaks German might be able to get the actual report. But here he summarizes that Dold was able to transmit upper respiratory infection to human volunteers by means of this filtrate. So 17 volunteers were inoculated with this filtrate, and then after they were inoculated, they would go home to where they lived, and there were 15 students who worked, ate, and slept in the same room with the volunteers, and these they considered controls. So 7 of the volunteers that got this spray of lab concoction, 41% got colds, or cold symptoms within 72 hours. And of the 15 students that they ate, slept, and worked with in the same rooms, it says here that none of those 15 students developed the affliction during the period of observation. So in other words, these lab people were able to make their lab volunteers sick by spraying this lab-created stuff into them. But then when they went home with colds, none of the people that they were around got colds. So in the lab, they could make people sick, but in the real world, nobody got sick. And in another experiment, there were 40 patients on surgical wards. They were inoculated with this filtrate. The results were essentially negative, as only 1 out of the 40 developed an upper respiratory infection. And it goes on to say that in this paper, irritating substances, insect powder can, when inhaled, produce the symptoms and signs of an acute infectious cold. Goes on to say that during the influenza epidemics of 1919 and 1920, so of the 196 people that were inoculated with this lab concoction, 21 developed like colds, 3 developed the grip. In the second group of 84 people, 5 developed grip and 4 colds. And it says 43, 8 developed cold. So he's basically just summarizing the difficulty that they're having in making people sick, or if they do the lab concoction into people, a low percentage of people get sick. And then they express the belief that there must be something there. And shortly after this communication, Williams, Nevins, and Gurley reported that they had been unable to infect 45 volunteers with the filtrates from other cold and influenza cases. And there was more investigations done with the flu, and these other people, Olatinsky and McCartney, they took some filtered concoctions and they were unable to produce any characteristic lesions in rabbits by this lab concoction. However, using another method, they were able to get several from the groups, but it wasn't consistent enough for them to consider it the cause of the infection. So using another method with humans, it says that they were able to transmit infections to human volunteers, demonstrating that it was a filterable agent. And it goes on to talk about another experiment where 100 human volunteers were inoculated with various filtrates. 5 out of 100 developed upper respiratory infections. Because of the small number of positives, they considered the cause to be something else. It was independent of the inoculations. And so if we go back and ask, well, what is this lab concoction that they're using that they're getting people sick? So we go to Google and we type in etiology of common colds. We'll get a link to the JAMA network. And according to Google, JAMA network is the Journal of the American Medical Association, peer-reviewed 48 times a year, been around since 1883. So JAMA has their articles behind a paywall, but they do have an abstract. So they say that the evidence of the common cold, the epidemiological evidence, seems to indicate clearly, he says, that these conditions are infectious. So they're trying to isolate, what is it? How is it infectious? To trace the causative factor by means other than bacteriologic methods, succeeded in producing colds experimentally. So let's see what the experiment is. And so we go down here, click on this JSTOR, we can get a full PDF and read the study. So it says it was Oxford Press, written by George B. Foster Jr. And if we Google George B. Foster Jr., we see that he was a brigadier general in World War II, a United States Army Medical Department officer. This is November 1917. So if we search for rabbits in this study, we get to talk about the kind of methods that are used to obtain this lab concoction, this culture, this filtrate. And it says at the top, the choice of a satisfactory ascites fluid is of prime importance. And then it goes on to say how they got this concoction. It is my custom to strap the rabbit to an animal board, and then the animal is stunned by a blow to the head, and then sharp knife, I guess, is passed through the neck to sever the cardioid and jugular. Then they raise the board so the body quickly becomes drained of blood. And it says death is instantaneous and painless, I guess if you don't count that blow to the head. And then they basically cut open the rabbit to get at the kidneys. Get down here. It says the intestine is lifted out of the way, a kidney exposed. And with fresh forceps, the kidney is quickly lifted from its bed and transferred to a large sterile culture dish. So I don't know about you, but I've never been to a rabbit farm that I'm aware of. I've never clubbed a rabbit in the head, never cut its neck, drained it of its blood, and pulled its kidneys out. So my question would be, how exactly is this proving the germ theory? In the real world, when people get colds or flus or whatever it is, like how does that, I'm trying to understand the reasoning or the logic, the rationale of how doing a lab experiment with rabbit kidneys equates to proving that people get sick from an invisible virus. There are various ways that they're getting these lab concoctions, this filtrate, the culture, whatever words they're using to describe it, of how they claim to transfer the virus, the illness, the cold, whatever they're claiming. And it says, during the period preceding these experiments, while the observations were being made, there was no epidemic of colds in the command. In other words, these are military men, and the emission rate for respiratory diseases was normal at the base, the garrison where these men are stationed, that they're using for volunteers. The men were chosen at random as they volunteered, and their duties, hygienic conditions, and general environment differed in no way from those of the remaining 250 men in the garrison. It would appear, therefore, that the experiments were adequately controlled. So then after they put this intranasal or this concoction of inoculation, this filtrate, into these volunteers, they were inoculated at 10 a.m. March 3rd with 5 drops of this subculture filtrate in each nostril, and then he returned to Fort Andrews. So Sergeant First Class Crampton of the Hospital Corps took notes on what happened then. 24 hours after this lab concoction was put into him, he had it, his nose was red and swollen and breathing through his mouth, complains of nasal stiffness and front headache, fever of 99.2 degrees. The following day, the nasal secretion diminished and had ceased by the evening. So these people were done, this lab experiment was done to them, and then they went back to the base. And at the base, there was no epidemic, there was no outbreak, there was no infection increase. The men didn't get sick. It didn't have any real world effect whatsoever. Only the people that got injected with this lab concoction got sick. And then when they went to the base with the other men, they're claiming it's an infectious disease, but yet it's not infecting anyone. Only the people that got the lab concoction got sick, whereas people in the real world that were exposed to these sick people, they didn't get sick. We go down to the conclusions, and it says, from the experimental evidence presented, common colds of the ordinary type are infectious. Why didn't the other 250 men in the garrison get sick then? Why only did the lab concocted, injected, lab experimented people get sick? Why didn't the people that were exposed to these so-called infectious people, why didn't they get sick? And I'm not claiming to know the answers, or I'm just reading the results. I'm reading what the experimenters did and the results they got. And they had a hard time making people sick. And only when they did these special, it took them years. They started in the teens, and 10, 15 years later, they figured out how to repeat this so-called infection. But they had to do it in the lab. When they did it, real tests in the real world of people doing normal things like breathing and coughing and touching each other, nobody got sick. And in reading some of these studies, they talk about how they tried to sterilize things, and the people wore masks, the nurses, the doctors, whatever, they wore masks, they wore whatever, and it had no effect either. In other words, any so-called sterilization or preventative seemed to do nothing. This PPE kind of stuff, they say that it didn't have an effect on the outcome. So if you have more information, if you know more of these studies that have been done and show how, not the lab concoction, but in the real world, how they demonstrate that the infectious part, the contagious part, that how it's proclaimed to spread is verifiable. Where's the evidence? I want to see it. I would love to see it. Like, show me. I want to know how to be healthy and stay healthy. And if there's something dangerous going around, I want to know how it spreads, how it gets from person to person, if it does, and how are people getting this, and what's making people sick, and more importantly, what makes people healthy? How do people stay healthy? Like, in all these experiments, it wasn't 100%. Even when they put the lab concoction in, it was often 50, 60%, and so the other 40, 50, sometimes high rates of people that were healthy, that it didn't, even this nasal thing didn't bother them. Why didn't they get sick? Why were they immune? Why were they somehow unaffected by whatever concoction lab built thing they got in their system? It didn't affect them. How, what are these people doing? What are the other factors that allow these people to be healthy? If there's this like super highly contagious, super deadly thing, why are a certain percentage of people completely unaffected by it? That's what I would like to see more focus on, is the people that are healthy and that are completely unaffected and they don't have any symptoms. Like, right? Wouldn't we all want to be symptom-free and unaffected by whatever's going around? Like, to me, that sounds like the ideal solution. Like, put all the studies into the people that are unscathed and are healthy and don't get bothered by this stuff. Like, that would be interesting. That's what I'm curious in. And so I hope this is helpful. Please, like it, subscribe it, share it around. Hopefully this satisfies the censors. I just got an email from Google today saying they're filtering stuff on the conflict in Europe, and they're, and I don't know the details, but it seems that it's an ongoing thing of squashing certain information, and so hopefully this gets past the censors and you can see it. And if not, or if so, look in the description, check links on Rumble or wherever else stuff like this can be seen censor-free. And thank you so much. And any way you can support, whether that's donation or membership on my website, come on over, and thank you so much.